I want to thank you all for coming today. We have people behind us, behind the members of Congress, who have actually come all the way from Orange County to be here. Hopefully you have a chance to talk to them afterwards and hear their just gut-wrenching stories. But this is a piece of legislation. The women of Main Street, Susan Brooks being one of them, and I travel the country, and we get to talk to all kinds of women. And mental health kept coming up and coming up. So this is a great result of our tour. We got back. Dr. Murphy, which I'm going to refer to him as Doctor today, had this legislation. We got behind it, and we're so proud today to be here with all of you to introduce it. So Americans of all ages, races, and backgrounds care about this issue, as you see them behind me. Nearly 50,000 people have signed a petition on our webpage. It's only been up for 1 week. We've gotten over thousands of stories from people just telling us what's happened in their families and how important this legislation is. This bill, which is dedicated work of Congressman Murphy, Dr. Murphy, is a prime example of good governance minded legislation being offered by Republican members of the House of Representatives. When this bill becomes law, it will improve the lives of millions of Americans. And this is the first time a mental health bill of this substantially has been done in 50 years. Kennedy is the last piece of legislation John F. Kennedy signed before he was assassinated. That's how long this has been. So I'm thrilled to introduce Dr. Murphy.
Thank you. Thank you. I appreciate you all being here, whether you're, particularly if you're a family who has suffered some of these tragedies. I also want to thank my colleagues, Leonard Lance, Susan Brooks, French Hill, Mario Diaz-Balart, my dear friend who worked so hard on this bill, Eddie Bernice Johnson. Of course, really good to have you here too. This quest for this bill really began in December of 2012 when America was shocked to hear of the killings at Sandy Hook Elementary School in Newtown, Connecticut. For those children, for Dylan Hockley and Charlotte Bacon and Daniel Barden, Olivia Engel, Josephine Gay, and others, we made a promise. For those innocent people in a movie theater in Aurora, Colorado, like Jonathan Blanc and Jesse Childress and Alex Sullivan, we made a promise. For people who were in a grocery store parking lot in Tucson, Arizona, like Christina Taylor Green and Gabe Zimmerman and John Roll, we made a promise. Where the perpetrator was someone with mental illness, for the victims and their families, wherever they are, whatever the place, we made a promise to provide treatment before tragedy. But as terrible and horrific as those events were, the story gets even worse. Yesterday was a sad day in America. Nearly 1,000 Americans died in an attack. It wasn't terrorism, however. It was the body count that occurs nearly every day in America from mental illness. Dr. Tom Insel, the former head of NIMH, estimated nearly 350,000 Americans died last year related to mental illness. Over 41,000 died from suicide alone. Over 45,000 died from drug overdoses. Over 1,200 died of homicides. And there are several scores of thousands of homeless or the neglected mentally ill who are caught in that slow-motion death spiral of chronic illness, which affects 3 out of every 4 people with serious mental illness. And there are thousands more people, and thousands upon them, with mental illness who were victims of assault and rape and fraud and abuse. We cannot stand by idly anymore. It is our time to take a stand for action and say, no more moments of silence, and no more just having wails of grieving. It is time we have to act. It's tragic that these horrific events happen in a nation so advanced as ours. It is doubly tragic that many could have been prevented. And it is triply tragic because inept and misguided federal policies are partly to blame for many of these deaths. You've heard the numbers of some 60 million Americans with some level of mental illness this year, from the very mild to the very severe. But there are 11 million with severe and persistent mental illness, and 4 million of those have no treatment at all. Those sometimes are people who don't understand they're ill, and they avoid treatment. They've tried to get help, but they've been turned away, like Cree Deeds and his son Gus, because they don't have enough hospital beds. Or they were in one of those counties that half of America's counties have no psychiatrists and no psychologists at all. They can't get treatment. And when there is no help, there is no hope. Our nation used to have plenty of psychiatric hospital beds. There was over 550,000 back in the 1950s when our population was only 150 million. Now our population is twice as high, and yet we only have 40,000 beds. So when we closed the hospitals, where did the people go who needed help? Sadly, we've traded those hospital beds for the prison cell, the homeless shelter, the gurney and emergency room, or forgotten in a county morgue. In the name of giving people the freedom from care, we have instead assured their right to be sick over their right to be well. We've abandoned the last, the least, the lost, and the lonely. We have created absurd federal barriers which say if you are low income, you can't see two doctors in the same day. Or if you are poor, you can't go to a psych hospital with more than 16 beds. If you're a minority, you can't find a minority provider. And no matter how much a family loves and cares the person with serious mental illness, they're shut out from helping. We fund very few programs that work. Some of them are very good. But we also waste millions on feel-good grants that teach you how to make collages, or unmask, or do an interpretive dance, or drink a fruit smoothie, or sing a song with animated characters on the internet, or call a crisis number if you are afraid of snow. Now, I'm not making this up. These are all facts pointed out in our investigations along with the General Accounting Office saying there is no accountability for these programs. But these are the real funding fiascos that got the money while needs for care went unmet. To all this we say this has to end. We must have treatment before tragedy. And tomorrow at 10 a.m., the full Energy and Commerce Committee, and some of these members are on this committee behind me, we will finally vote on H.R. 2646, the Helping Families in Mental Health Crisis Act, to fix the bed shortage, to get more doctors, to let families be partners in care, to clean up the grant programs, to direct funding for evidence-based programs that make a difference, to integrate physical and behavioral medicine, to get more care to underserved and rural areas, to train more minority mental health professionals, and put professional leadership at the helm of our key federal agencies by creating the office of an Assistant Secretary of Mental Health and Substance Use who will be a doctor. And we will let people know that we break down the stigma of mental illness not through slogans, but through real evidence-based care, where people know if they get care, they can get better. Because we want them to know where there is help, there is hope. And tomorrow we will vote to make sure that help is on the way. So, no more silence, no more inaction, because we know you can't treat mental illness with denial. You can't treat it with sentencing a person to prison or abandoning them to homelessness or a cemetery. For the victims, for their families, for the millions of Americans struggling with mental illness, please know we heard you. And tomorrow, after a long, long wait, we are keeping our promise to you and taking a stand to bring real care for mental illness. My heartfelt thanks go to Representative Bernice Johnson for her incredible, steadfast work and dedication to this cause. As a VA, yes, let's hear for it. As a VA psychiatric nurse, she has seen this in the trenches, and she never let up. To all the co-sponsors, I think as of today, 194. We could use 6 more to get to 200. And especially to Chairman Fred Upton for his dedicated leadership to get this bill moving. And for all the professional organizations who have endorsed this bill, from all of us, thank you. But know this, passage from committee with a strong bipartisan vote is a critically important step, but it is not enough. We must also all call upon leadership to bring this to the floor for a full vote immediately and ask the Senate to take this up as fast as possible, because any delays maintain the deadly status quo and block persons from getting help with this brain disease of serious mental illness. And treatment delayed is treatment denied. So today, on this beautiful, bright morning, we jointly proclaim that the diagnosis and treatment of mental illness must come out of the shadows, and we declare a new dawn of hope for the care of those with mental illness. And we pledge our unwavering commitment to continue work to bring help and hope in the future. Thank you very much. And now let me introduce the Prime Democrat co-sponsor of the bill, my friend Bernice Johnson.
Thank you very much. Let me first thank my colleagues who are here, and thanks to all of you, because this represents at least 2,000 or 3,000 more people than what's standing here for each person standing here. It is not a secret that there are people all over this country that deal with mental illness and their families every day. And just yesterday, one of our opening speakers, Sarah Chamberlain, wrote, "America is in the midst of a national mental health crisis. Over 40 million Americans have mental illness. Nearly 10 million have a serious psychiatric disorder such as schizophrenia, bipolar disorder, or major depression. Millions of people who experience mental illness go without care, and many of them end up in prison or on the streets or dead. Each year, 41,000 Americans die from suicide and 44,000 from drug overdoses, a number equal to all of the combat deaths in Korea, Vietnam, Afghanistan, and Iraq combined. Women are particularly impacted by mental illness because they make up 2/3 of the caregivers." Ms. Chamberlain's words could not be more poignant at this time of this crisis. We were also in crisis almost 3 years ago when Congressman Tim Murphy approached me to work on this comprehensive mental health package with him. Since then, our country's mental health system has not improved, especially for the seriously mentally ill. He approached me because I had introduced a bill earlier to try to get Medicaid to cover mental illness. As a non-practicing registered psychiatric nurse, I have seen firsthand the federal policies that inadvertently harm mentally ill patients. Congressman Murphy and I have focused each of our careers on helping those patients, and we have brought the same focus to this legislation. This is why it is so important that we pass H.R. 2646, the Helping Families in Mental Health Crisis Act, in its amended form. I cannot tell you the many hours that Congressman Murphy has spent working both sides of the aisle, trying to understand, trying to cooperate, and there's not a person here who can say that he has not been in contact with them if they had a question. I'm delighted that this bill will be marked up in committee on Energy and Commerce tomorrow. Today, and I'm confident our colleagues will move it forward. The time has come and gone that we should be giving attention to our mentally ill. We're seeing the effects of not caring every day. In my state, every day, there are stories that talk about the need for mental health care. And every day, there's another person put in jail because there's no other outlet for the family to get relief. It is time for this leading nation of the world to address one of the most serious problems, dealing with our mentally ill crisis. Thank you.
Our last speaker has a very sad story to tell. She's going to represent all the stories that are in the program that you got, and also behind us are people that actually came from Orange County. One woman came on a bus to tell her story. We'd love to have you maybe interview them afterwards. But Doris Fuller lives here in Arlington, and she's here to tell all of you her personal story and just kind of bring this home. So it's not just a bunch of members of Congress and myself talking, it's a person who has really lived this.
It means a great deal to me to be here today. As many of you probably know, you may have read the story, I was the mother of a beloved daughter who suffered from severe mental illness, who killed herself a year ago by leaping in front of a train in Baltimore. I usually write out my comments because I'm not sure I can get through them, but I just have some speaking points. I know it from the heart, so I hope you'll trust me if I have to take a deep breath from time to time. My organization, the Treatment Advocacy Center, has worked for almost 20 years to do something about the broken mental health system. And so this makes this an incredible red letter day for us professionally, but for me personally. My daughter, Natalie, who died at 28, a month before her 29th birthday, was a victim of Americans' broken mental health system. HR 2646 comes too late for my daughter, but it's not too late for millions of other Natalies and Nathaniels. Most of us find mental illness because mental illness finds us. We get on-the-job training at being a parent, a family member, a friend, a coworker, an advocate for severe mental illness. We do it, we have done it for 50 years against terrible odds. Bad laws, discriminatory policies, bed and personnel shortages, such as Representative Murphy mentioned, a mental health system that favors the functional over the really severely ill, a system that has turned mental health intervention into a police act. HR 2646 is a crucial step toward changing that. And I want to give you 3 personal examples from my life about why it's important. I have to say going in that there are pockets of functional mental health service in America. My daughter was lucky that she had her first psychotic break in one of those, which was a small college town in Idaho, of all places. I want to talk about 3 differences. Then she moved to Virginia because she wanted to be near her mother. And when she decided to do that, I said, Natalie, Virginia, Maryland, this is a great place to get some services if you're well, but if you get sick, it's not a great place to be. So here are some differences I experienced in 3 areas with my daughter that made a difference in her life and her death. Beds. Representative Johnson has worked for years trying to do something about discriminatory Medicaid policies. In Idaho, there was a waiver, so in addition to some hospital beds, not a ton, but enough that she never once sat around in an ER waiting to get a bed. There was always a bed for her. There were actually beds when they were ready to discharge her from the hospital. As any family member knows, this is a pretty remarkable development. And so what that meant was when Natalie stabilized, and by the way, in the beds in Idaho, the average stay was 45 days. Nationwide, it's 7. So when she stabilized, when her medications were therapeutic, and they were ready to release her, their policy was, well, we can't release her until there's a suitable place to send her. And once I had moved to Virginia, I was not a suitable place, I was too far away. So they had what are called IMDs. They had institutes of mental disease that weren't hospitals where she could go live with 60 other people who were recovering. When she moved to Virginia and she had to be hospitalized and it was time to release her, by that time, sadly, she had become a danger to me and I couldn't let her live with me. So I said, where are you going to send her? And they said, we'll give her cab fare to a homeless shelter and 1 week of meds. Is this how we treat people in America? In most places it is. Beds. We need more beds. We need crisis beds. We need medium-term beds, and we need recovery beds. HIPAA. So I have many stories about HIPAA, but I will hold them to one. So a couple years ago, I was asked to speak to a group of university, college, and deans, college deans and deans, the deans of students. And I told the story of Natalie getting sick on campus, which was fairly dramatic. One of the things she did was she stripped herself head to toe, painted herself blue, and pressed body prints all over the walls of the art building and called it art. And she had a very good rationale for why it was art, but the school didn't quite view it that way. But the school worked with me nonstop to get her into treatment. They were unstinting in their support, in sharing information, in involving me, as was everyone else in the system. So I talked to this group and I tell them this story. And I say, is anyone here from the University of Idaho? And these two little hands go up. And I say, thank you for what you did to my daughter. It made a difference. And they came up to me afterwards. And I said, you know, I've now been working in mental health policy for a few years. And I know more about HIPAA and FERPA and things like that. How in the world did you talk to me like you did? How did you involve me in her treatment? And they said, the law is open to interpretation. Our interpretation is that we do what is in the best interest of our students. That's what we did. Now, contrast this, she moves to Virginia. She has a violent episode. She's taken by ambulance to Virginia Hospital. She's bleeding. She has to be stitched up. She's severely psychotic. I'm there with her. I ask the nurse a question. The nurse says, I can't talk to you about her. She says, go talk to the ER physician. I go to the attending physician. I say, you know, I have information about her. I need information. I was with her during the episode. I'm rather traumatized, to tell you the truth. And he says, oh, I can't tell you anything. Her privacy is protected. And I said, oh, okay, I'll just go get her to sign a release. She'll sign a release. And he says, oh, no, we can't take a release. And I said, why not? And he said, because she's mentally incompetent and she can't give a release. And I said, wait a minute, explain this to me. My daughter is so sick, she can't give a release for someone who knows her history to talk to you? And yet you won't talk to me? This is HIPAA being misinterpreted, and 2646 will take aim at that. And finally, I want to say something about laws, the laws, and how the laws, the policies from all these years have affected our loved ones and this issue. When I first went to court with Natalie, who was civilly committed, I'm in 3 different states, multiple times, the caseworker came up to me and he said, you know, 8 months ago we couldn't have helped your daughter. 8 months ago we had a law that said we could only commit people once they were dangerous. But we got a new law. It passed. It was signed by the governor exactly 8 months ago. And now we have a legal basis for getting her into treatment before she gets worse. When I got to the Treatment Advocacy Center about 1.5 years later, I found out that we had written that law. When Natalie got sick in Virginia, she had a caseworker. I said, is there anything? She went off her meds. I knew off her meds she would be dangerous to herself. I said, is there anything you can do to intervene? And they said, no, not until she's dangerous. I used to when I give interviews, people used to ask me before this bill, before all the things going on in the states, before the tremendous surge of interest in finally doing something about mental health, people would say, what has to happen for this to change? And I said, people have to care. Lawmakers have to care. Congress has to care. If we care, we will do something. When we started caring about cancer, the cancer mortality rates went down. When we started caring about AIDS, AIDS went from being a death sentence to a chronic disease. We're here today because you people cared. We're here today because of Chairman Upton. We're here because of Senator Chris Murphy. We're here because of Bill Cassidy. We're here because of John Cornyn. We're here because people in this building cared, and because their constituents care, and because Americans care. And so my word my closing word, as a family member, we aren't going to save everyone. We can save far more people than we are saving. So now all you have to do is convince the rest of the people in that building to care enough. Let's go out and get us a landmark law.
I want to thank you all for coming. If you have any questions, I want to thank all the members for being here and Doris for telling your story. We have a lot of other advocates here who will tell their stories, so feel free to ask any questions. And again, thank you for being here on this beautiful sunny day.